Thank you everyone for joining this conversation. I think it's a really timely and important conversation that we're having today. And I hope we walk away very educated and aware of how to protect ourselves, our families, and our communities. My name is I'm the CEO Managing Director of F3 Global Advisory Group. And currently I'm supporting the African Women's Cancer Awareness Association under a CDC Foundation grant, which is focused on educating and empowering the greater DMV African diaspora on COVID-19, influenza, and vaccination. This is one of many future webinars focused on COVID in general to better educate you on the process, the facts, and like I said, how to best protect yourself, your communities, and your families. We have an excellent guest speaker in Dr. Ekuta, and wonderful host organizations in the African Women's Cancer Awareness Association, and a collaborator in Omega Psi Phi. So first, I'm going to introduce you to Ms. Ife Nwambuku. She is the Executive Director and founder of the African Women's Cancer Awareness Association, also a practitioner by trade in education and an advocate for healthcare for the African and diaspora communities across the DMV and globally. She has grown AWCAA from a nonprofit primarily focused on serving African immigrant women to an organization focused on the greatest health access and challenges across the greater DMV area and targeting primarily the challenges that we have in providing access and care. So Ms. Ife.
Thank you very much for that introduction. Good afternoon, everyone. My name is Ife Nwambuku. I'm the Executive Director and the founder for the African Women's Cancer Awareness Association. So on behalf of the Board of Directors, the staff, and the volunteers of this, we welcome everybody to this webinar. It's gonna be a wonderful time. We have a great speaker, and we're here to make sure we move forward our community. COVID is here, it's real, and we don't want our community to take the brunt of all that is happening in the COVID era. So our goal today is to work to make sure that we empower you, we educate you, and we continue to encourage our community as a whole to take advantage of the vaccination, because at this time, we know that's the one thing that protects us and can help us. We have a CDC grant, which we are very proud of and are happy. And so it's our joy to collaborate with our brothers today. So I'll pass the mic back to Ms. Helen so she can introduce our collaborators. We're glad to be working with you, and we look forward to future endeavors with you. Thank you all very much.
Thank you, Ms. Ife. So as Ms. Ife said, we're excited to be working with Omega Psi Phi, specifically the Psi chapter. So I'd like to first introduce Mr. Dante Jickets. He was born and raised in Richmond, Virginia, and attended college at James Madison University. Upon graduation in 2011, Mr. Jickets has been an IT professional for nearly a decade and is a sought after both for his expert leadership skills. He currently serves as the Vice Bacillus of the Psi New Chapter of Omega Psi Phi Fraternity Incorporated, where he works with the executive committee to ensure that the chapter continues to do great work in the Alexandria area and beyond. So I'll go ahead and hand it over to you, Mr. Jiggets.
All right, hello everybody. Thank you so much, Ms. Helen, for the wonderful introduction. As she mentioned, I'm serving as the Vice Bacillus of Psi New Chapter, and Omega Psi Phi in general takes health very seriously. One of our internationally mandated programs is the Health Initiative. And as an organization, we have been making sure we lead by example, making mandates for brothers of the organization to wear masks, whether we're in social gatherings, or any events, so that we can lead the charge. There's also a push to for brothers to get vaccinated, because we want to make sure that people understand that COVID is a very real thing. And sci-fi, we want to lead. We service the Alexandria area primarily, and so our health initiative, we have a branch of health initiatives that we also work for, and that is why we're very happy to partner with this organization, because we just want to continue to spread good works and good information towards the communities that we serve, so that they may be able to live the healthiest lives they possibly can. And with that, I'll turn it back over to Ms. Helen.
Thank you, Mr. Jiggins. Before we move on, I first want to thank Mr. Garrett James for helping this collaboration happen and bringing this connection to our table. I think it's really important that organizations like this really collaborate. As you said, Mr. Jiggins, it is a primary focus for you guys, who says it is for our organization. So collaborations and platforms like this, where we can get accurate information from experts in the community who look like us as guys. Before I hand it over to my colleague, Chris Chukwuyuneri, I'm gonna go ahead and play a quick video for you guys in terms of what AWCAA has been doing in the community. And then we'll go into our primary conversation with Dr. Ekuta. So give me one moment and I will share my screen. All right, can everybody see and hear this?
It's time to get rid of COVID-19. I'm out here today to encourage everyone to come out and get vaccinated. The numbers will drop and we'll be out again like we were before.
I think you should get vaccinated because you want to keep everyone safe, and it's for the greater good of your family.
There are several vaccination clinics within the county. They're bringing it closer to you so you don't have to worry about driving if transportation is a barrier. We did a lot of outreach, education in the community, in our various churches, in our various local communities, in our families, so that people will get the awareness and know that this COVID-19 vaccine is very important in preventing COVID-19 infection. Get up and go get your vaccine if you're not vaccinated yet.
I want my community, I want everybody who lives in the country to be vaccinated. So we can take the mask off, we can go places, we can enjoy ourselves. We are proud to be protected.
Fully protected.
We encourage you all to go to your local pharmacy, a vaccine clinic.
Pass the word around. It's not too late.
It's not too late.
It's not too late.
To get your COVID-19 vaccination
Today,
Today.
AWCAA COVID-19 vaccine and no set.
Unavo vaccine, it's not too late.
We're war with COVID-19 and we're gonna win.
Hopefully everybody see that. All right, great. So thank you all. And I'm going to hand it over to my colleague, Chris Chukwuyuneri, who was actually in
Book your
Nigeria.
summer travel with free cancellation on hotels.com.
Thank you, Chris.
Thank you, Helen. Thank you, everyone, for joining today. It's an exciting moment for us, and we are happy to be collaborating and bringing this to you. Today, we have a very special guest. He's been a member of the AWCAA family for about a year now, since the COVID-19 pandemic started. And he's been a very great resource person, highly experienced. And his name is Dr. Jethro Ekuta, and he's the Vice President, Global Regulatory Affairs, Alexion Pharmaceuticals Incorporated. So you're welcome, Dr. Jethro. The mic is now passed over to you for your presentation.
Thank you very much, Chris. Let me see if I can share my slide. Can people see my screen?
Yeah.
Oh, very good. All right. So first of all, I just want to thank you folks for inviting me to this presentation. What I intend to do today is really try to break things down in a very simple manner. I know many of you on this call are healthcare professionals, and some of the information that I'll be presenting will be fairly, very simple, very basic for you. Please know that my intention is not to ensure how many people would be on the call. And so I wanted to make sure that everyone, whether they have a healthcare background or not, is able to have a basic understanding of what we are dealing with. So the way that I intend to proceed is start out really by just walking us through answering three basic questions: the what, the how, and the why of COVID-19 variants. And then briefly how those variants are classified. And then we go into a Q&A session for people that may have questions. So beginning with the, with the what. So basically, when you talk of a variant, you are talking of a virus whose genetic sequence differs from that of its parent. The parent being the virus. Viruses do change all the time. A common example of that is the flu virus. We all know that like every season they have to make new vaccines because there's a new strain or just a new variant that needs to be addressed. And you will understand why that is the case as we go through the presentation today. So if you talk of a variant, it just means a virus whose genetic sequence differs from that of its parent. But really, in order for us to understand variant, we have to understand another terminology called mutation. And it really is a change genetics the virus. And I will talk about what a genetically. But whenever there is a change in the gene sequence, that means the sequence of things like we call bases. I'll talk to you about that shortly. The way that those things are arranged, they are arranged in a very precise manner. And if a change occurs, which of course happens so frequently, then it actually alters something about that virus. So any type of change in a genetic sequence is called a mutation. So the word mutation and variant, can be used interchangeably because they both represent a change to the genetic sequence. They are very common. They happen all the time, not just to viruses, they happen to other things. But with viruses, these changes occur very frequently. The good news is that many of those changes are inconsequential. They don't result into big problems, but every once in a while, some of those changes may become a big deal, like we are dealing with the Delta virus today, which I will talk about some more later as well. So for COVID-19, it's been said that roughly 4,000 of those type of mutations have already occurred since we became aware of the COVID-19, which is COVID-19 virus. Since we became aware of it, it has undergone at least 4,000 different changes. I will tell you about what the structure of the virus looks like and what is actually changing. These changes are to a part of that virus called the spike protein. So there are roughly 4,000 or more of those. So these mutations, arise typically when you're breaking a piece of paper through the photocopying machine. A number of things happen. You could come out with exactly the same copy that you anymore. those errors then called mutations can become a big deal. There's another term which I'm not going to deal with today, but I just want you to be aware of it. You might have heard of the term strain, a strain of the flu virus, strain of another virus is here. Strains are actually have experienced many, many different mutations. That is many different changes in their genetic sequence to the point that they are able to significantly alter how that virus behaves. So if you have virus A and it has undergone so much changes to the point that it no longer really looks like the same virus A, but you can actually now call it a virus B because it's completely different. Then it becomes a different strain of that virus. That's all I'm going to say about strain. Today, we are just going to focus about variant and about mutation. So let's answer the how. How do these changes occur? These changes that I'm calling mutations for COVID-19, how do they occur? First thing I want you to remember is that the COVID-19 itself, the virus itself, it has several parts, but there are two important ones that I want you to remember. The first one is that it has a gene, or you can call it a genetic material, or some people will call it a genome. It's all the same thing. So that virus has a gene. That gene is known as RNA. You've all heard of RNA, or ribonucleic acid. And the second part of the COVID-19 virus is a set of proteins. So these proteins encapsulate or they form a circle around the gene. So the gene is, so if you think of like, a basketball or a soccer ball or a football, the outside of that ball is made up of proteins. And then inside of it is this gene called RNA. So think of the virus in that respect. Now, an RNA itself, which is that genetic part of the virus, is really it's a string of materials known as ribonucleotides. It's a string. So if you think of like a chain, a chain that has different pieces of metals that make up the chain. In this case, those pieces of metals is what I'm calling ribonucleotides. So these ribonucleotides have three major parts. They have a sugar called a ribose sugar, they have a phosphate, and then they have a base. Today, I'm not going to talk about the sugar or the phosphate. I'm only going to focus on the base. So the base is really, there are four different types of bases. One is called cytosine, represented by the letter C. Another is uracil, represented by the letter U. You have guanine, represented by the letter G. And then adenine, represented by letter A. I use the acronym GUAC, like the short form of guacamole, because it helps me to remember it. Because DNA has a similar thing, but one of the bases is different. So if you think of GUAC or GUAC, these are the bases. Think of them like they are the ones making a chain. And then if instead of thinking of them like alphabets, if you think of them in terms of color, let's say the G, because it starts with, because green starts with the letter G. I represent G with green. I represent U with yellow. I represent A with amber. I represent C with blue, because C rhymes with C of water, which is usually blue. So let's say these are the color codings. If you can imagine a set of chains that are arranged with these different colors in them. If I just use the simplest example of just going with GUAC, 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 that is GUAC, followed by GUAC, followed by GUAC. If you think in terms of color, it will be green, yellow, amber, blue, followed by another green, yellow, amber, blue, followed by another green, yellow, amber, blue. Just think of a long chain that is arranged like that and consider that your normal gene of the COVID virus. Let's say that's the normal gene. So what happens is once that gene is injected into the cell, so the COVID virus, the way it functions is, that virus with the outer coating of protein will attach to a cell. Then the gene or this genetic material gets injected inside the cell. And then the empty case is destroyed by the cell. But this gene goes ahead and uses all the tools inside that cell to make copies of itself. In the process of trying to make those copies, errors are introduced. That's where the mistakes occur while it's trying to replicate itself, because it wants to be alive. Unlike human beings that can replicate through the usual process of reproduction, these viruses cannot do that. So what they do is they replicate themselves in a very unique way. So there are 3 different ways by which errors occur. One type of error would simply be a deletion. Remember let's say, this normal sequence that I told you is GUAC, or green, yellow, amber, blue. A deletion would be removing one of those colors. If we just focus on the first color, which is green, if you take out the green, then in that particular spot where you took out the green, you are only left with yellow, amber, blue. That alone is going to change the rest of the sequence of your genetic code. Apart from deletion, another way you can have an error is an addition. You add something extra that wasn't there in the original. In this case, if we added another green before the first green, now the sequence will become green, green, then yellow, amber, blue. So that introduces an additional base that wasn't there at the beginning. A third way is a replacement, where you take one base and replace it with another base. So if you take that same green and now you replace it with, let's say, another blue, your sequence, instead of being green, yellow, amber, blue, it will become blue, yellow, amber, blue. The significance of this is that when you make that change in the sequence, it affects the way that that code is interpreted, because the whole purpose of the genetic code is to interpret to the cell which protein to make. So if you change the sequence, you are going to end up with a protein that may be different from the protein you intended to make. And that's where the trouble comes, when you now have different strains. So essentially, any of these changes that I talked about, whether it's a deletion, an addition, or a replacement of a base, it will change the genetic code or the genetic sequence. And this is what we call a mutation. So a mutation, as I said earlier, is simply a change in the genetic sequence of the virus. But this is important because, as I said, it is this sequence that determines the type of protein you can make from that genetic code. So a protein usually is made up of a series of amino acids. And these amino acids are formed by those bases of green, yellow, amber, blue. Typically what happens is 3 of those bases. So if you take green, yellow, amber, for example, it makes 1 amino acid. Then you take the next 3, which could be green, blue, green. It will make a second amino acid. The third one may be green, green, green. It will make a different amino acids. The joining of all of these amino acids is what makes a protein. So a protein is a series of amino acids. And that's where mutations become significant, because if you alter the arrangement of that code, then you may end up with a protein that may work or may not work. So usually mutations, most of them do not cause any change in the protein that is made by that code. That's the good news. We are very fortunate that even though thousands of these changes occur on a daily basis, most of them don't cause any problem. And these are called silent mutations because they just go on, like the example of photocopier that I used for you earlier. if you make a photocopy and let's say a little bit of it, got some staining, it may not affect your ability to read the entire paper. You can still read everything. So it's inconsequential, even though there was some change, because it's not exactly like the original one, but it hasn't changed your ability to read the paper. That is silent. That is a silent mutation. But some others could actually change the amino acid sequence is made by that gene. And in either case, regardless of whether the gene caused the change to the protein or didn't cause a change to the protein, they may not have any functional consequence to the virus, which means the virus will behave the same way it did before the change occurred. But what happens is, in some cases, these changes could become significant. So some of those changes can affect the ability of the cell in which the viruses are present to actually attack the virus and get rid of it. Some of them could affect the way that the virus binds to the cell. They may actually increase the virus's ability to bind more efficiently, meaning that the virus will be able to get into the cells much more quickly. They will be able to do the damage that they need to do much more efficiently, and may result in increase in the severity of the disease. So a disease that ordinarily might have been mild could suddenly become very severe. Or it could affect the ability of that virus to replicate itself, which means it multiplies faster and it spreads faster. And it can affect vaccines. If you give a vaccine, because the way the vaccines are made is to exactly counter a virus, if you now change the shape of that virus in any way, your antibodies that are in the vaccines may not be able to do what they are supposed to do. They may not be an exact fit that counters the protein of the virus. And that's where the issues usually come. So I wanted to make sure that you had a good understanding of what a mutation is, what causes them, and how they occur. So to answer the why do these viruses even need to change? Why do they need to mutate? You have to think of it, like a situation between an owner of a house and a thief. The thief wants every opportunity to be able to invade your house, and you are doing everything you can to keep the thief away. You could get a security alarm system. You could, have other things. You could make sure that your doors are all bolted. You could make sure that you have, camera that can see if a thief is coming. The thief is aware that you are doing those things. So the thief is also going to look for a way to evade those things because they don't want to be caught. They want to steal and go to the next person and steal some more. That's exactly what these viruses are doing. When they invade the body, it triggers our body to produce antibodies that counter them and destroys them. But they don't want to be destroyed. They want to maintain themselves. They want to be present. They want to multiply even more. They want to cause more problems. So they are changing because they want to evade our body's ability to destroy them. That's the real reason that they change. And these changes are very spontaneous. The virus doesn't suddenly sit down and say, oh, let me change my green to blue. These things happen spontaneously, but there are a mechanism built into those viruses to enable them to continue to perpetrate themselves. As I said, some of those changes may be consequential, others may not be consequential. So now that I've established that basic understanding, let's now focus on what we know about this COVID-19 variants. According to the Centers for Disease Control, the CDC, these are a few of the things they suggest that we know that these viruses are constantly changing through mutation, and new variants are surfacing all the time. You should expect that these things will occur because that's a normal part of a virus's behavior. So sometimes these variants may show up, other times they disappear, but sometimes some of the new variants may just persist in the environment for a very long time. But many of these variants that cause COVID-19, the US government is tracking them. The World Health Organization is also tracking them. So we expect they will happen, but the best way we can slow their emergence, because we know that the way they happen is through replication, when they duplicate themselves. So the best thing we can do is to reduce their ability to spread, because as long as the viruses are spreading from one person to another, they are going to continue to evolve ways to evade the immune system, and thereby you are going to continue to get variants. So what vaccines do is to keep, vaccines do three very important things. The COVID-19 vaccines, the ones that are approved so far, they prevent someone from getting sick, from getting hospitalized, or from dying. So they prevent serious illness. If somebody is vaccinated, even if they come down with COVID-19, it will not be as severe because the vaccines are able to reduce the impact that the virus could have. So the good news also is that all of the COVID-19 tests that we know today, they can detect all the different variants. What those tests will not tell you is which variant do I have. So the US government, as well as World Health Organization and other health agencies, have come up with a way to classify these various variants. In the US, there are three ways they've categorized these different variants that have arisen. One group is called variants of interest. This means these are variants we are watching very closely because at any moment they could become problematic. These types of variants occur maybe in very small populations. They are probably not interfering a whole lot with our ability to, to test. If somebody gets a COVID-19 test, to be able to get the results accurately. They may not be interfering with medicines that we are using to treat COVID-19, or even lowering the impact of vaccines to a degree that we'll be concerned about, right? But these are things we know that if we don't watch closely, they could go from something we don't worry a whole lot about suddenly to something that becomes a big deal. So there are some of these variants that are classified into that category. The second category are the variants of concern. These are the ones that we know for sure are already causing all kinds of problems. Either they are reducing the ability of the existing vaccines to do their job, or they are making the viruses to be more virulent, that is cause more severe disease, or increase the ability of these viruses to spread from one person to another, that is make the virus become more contagious. So these are the variants of concern, and these are the ones that the government is dealing with. Like right now, we need to address these variants and make sure we have them under control. Then the third category are variants of high consequence. These are ones that are really, they are truly problematic. These viruses have gone to the point that now whatever vaccines we have available is not doing anything to impact the outcome. It's not changing. These viruses are killing people and we can't deal with them. Just like at the beginning when COVID started, that would be the kind of, is that as of today, we do not have any variant of high consequence in the United States. Thank God for that. So I'm only going to talk briefly, very briefly, about the first two types of variants, the variants of interest and the variants of concern. Now, if you look at the various variants, so those who are naming the viruses have come to the agreement that they should use Greek letters to identify the variants. They could have chosen to use, numerals like 1, 2, 3, 4. The first one will be called 1, second one will be called 2, third one will be called 3. Or we could use our usual alphabets A, B, C, D. But they chose they will use Greek letters. I mean, those of you that know a little bit of Greek or who have been in fraternities or sororities, you are familiar with some of these Greek letters. So the variants of concern that we have in the US today, there are 4 of them. Alpha, which of course corresponds to the letter A. The alpha was the first one that was recognized, And this was identified in the UK back in 2020. But that is also present in the US. But we have a second one, beta, which corresponds to letter B. And that was identified in South Africa also back in 2020. Then you have the gamma, which was identified in Brazil earlier this year. And of course, the delta that most of everyone on this call, I'm sure you of the Delta virus, of the Delta form, of the Delta variant of COVID-19. That was first identified in India, also earlier this year. And of all of them, the Delta is the one that is most problematic because it is spreading very rapidly. It can affect a lot more people than we had with the original COVID virus. Of the viruses of interest, the ones that I said, the government is keeping an eye on them, but as of today, they are not a problem. We don't worry about them because even if they occur, we can treat individuals and life will go on. But these include the epsilon, zeta, eta, theta, iota, and kappa. So these are the variants of interest that government is keeping an eye on. As I said, the other type of, the variants of high concern, these really don't exist today. So I'm only going to just briefly focus on the Delta variant because that's one that a lot of people are worried about. So the Delta variant, what is known about them is that they cause more infections. That means they are able to spread to a lot more people than the original COVID-19 virus. They also spread faster than the original virus, and they can cause more severe illness than the original virus, especially in people who are not vaccinated. So these three things are the reason why this is a variant of concern to the government. It is the most prevalent right now in the United States, more common than any of the other variants that you might think about or the original virus. But there are some good news. One of them is that vaccines continue to reduce a person's risk of contracting this virus. Okay, so if you are vaccinated, then your risk of getting the virus is greatly diminished. And if it turns out for whatever reason that you actually become infected, it is not going to be as serious compared to someone who is not vaccinated. The second good news is that the vaccines we have today continue to be very highly effective at preventing people from being hospitalized or dying, which essentially means these vaccines prevent severe illness. That's the real benefit of these vaccines. They prevent severe illness. So people should get the vaccines because if you get them, your likelihood of dying is almost close to zero. Your likelihood of getting illness that is so severe you have to be hospitalized, like having to have breathing tubes inserted into you or needing extra oxygen and stuff like that, those will be greatly diminished. The likelihood will be much, much lower. You could have COVID-19, but it will be mild. It's like having a mild flu, which anybody can handle. Another good news is that people who are fully vaccinated, who end up having a breakthrough infection from this variant, they appear to be infectious only for a short period of time. That means they're able to transmit the virus for only a very short period of time. So really, they are not spreading the virus as much. If they have to, it lasts only for a short time compared to someone who is not vaccinated. So the real thing at the end of the day is that we should get vaccinated. We should wear our masks when we are indoors, especially in public places. And this will help to reduce the spread of this variant. Because this is what happens. If we allow any of the variants to continue to remain in the environment, guess what? They are going to continue to divide or to replicate. And the more they replicate, the more those errors I talked about, the mutations. And those mutations may end up with something that may be so severe, we will not have any immunity against this, and then we'll end up having another set of pandemic. This is what we want to avoid. This is where vaccine comes in, and this is where vaccine helps, because it reduces the likelihood of those things happening. So the final slide I wanted to show on the Delta virus is just to pictorially, this is on the CDC website, to illustrate that the Delta variant is more contagious. That means it can spread to more people compared to the original virus. If you look at the original virus, one infected person would likely spread the virus to 2 more people. But if you compare that to the Delta virus, one infected person with the Delta virus may be able to spread it to about 5 other people, meaning that it's more than 2 times. It can cause more than 2 times as many infections as the original virus. And this is because the virus has mutated. The virus has changed to this Delta strain, Delta variant, which is now truly problematic. So everybody is working very hard to try to get a good handle on this on this Delta strain, sorry, not a strain, but a variant, so that we can control it, get it under control, stop it from spreading, and then have everybody be able to go back to normal lifestyle. So these are really the fundamentals of what I wanted to share, and essentially to leave much time for questions and answers. Any questions that people may have, so that we can discuss them as a team. If I can answer them, I'm sure there will be someone on this call who may be able to answer the questions. So I'm going to turn it back over for us to do the Q&A. I don't know if people have sent in any questions through the chat or through other means, or people want to ask live. Please, this will be the time to do so. Thank you for the opportunity to share some information, and I hope it was information you found useful and helpful.
Thank you, Dr. Jethro, for that amazing session. Just going through the chat boxes, we've seen that there are lots of comments, about how everyone has, been appreciating the information that you've been sharing so far. We've learned quite a number of things, new things. It was really simple and it was broken down for everyone to really understand. I can see a question from G. G, would you want to, are you still around? Would you want to just quickly ask the question? I can see you dropped a question in the chat box. Is G still around? Okay, so
go ahead. Go ahead and just ask
let me read the question. It says, I've heard about the Lambda variant. Is that a thing?
Well, so the ones that I shared with you, these are the variants that the United States is tracking, because either they've been reported somewhere in the US and they appear to be serious, or one that they feel is worthy of following, so that they don't become serious. There could be variants in other countries, like you mentioned, maybe Brazil or elsewhere. I did not address any of those. But as new variants occur, these variants are being given those Greek letters, like I said. So yes, there could be a Lambda somewhere. But today, if Lambda exists in the US, it doesn't fall into one of those 2 categories I mentioned, either strains of interest or strains of concern, and certainly not the 3rd category, for which none has existed.
Great, thank you very much for that answer. Is there any other question from anyone? Any other question?
Okay, great. So I actually have a question, Dr. Ekuta. So there's a lot of kind of, I think, miseducation around vaccines in general. Can you talk a little bit more in regards to like, as people who do educate the community, like what should we be telling people in terms of how the vaccine really does protect them from the Delta variant? Like what are some message points or things like that that we should know or at least focus on?
I mean, I think those message points were, the points that I made toward the end of my presentation, which are that one, we know that the existing vaccines are very, very effective, even against the Delta virus, right? The difference is, yes, the level of effectiveness is slightly reduced, but they are still effective and they can still prevent someone from getting severe COVID. So if you get the vaccine, any of the ones that are approved, whether it's the Pfizer vaccine, the Moderna vaccine, the J&J vaccine, any of those, if you take them, they are capable of, they can work and they will prevent severe illness. In the worst case scenario, you may have a mild flu-like symptom. Maybe you're sneezing, you have high temperature, you may have aches and pains, but you're not going to end up in the ICU, with a tube hanging, put through your neck to help you breathe. So that's a real benefit. And I think it's important that people know that the current approved vaccines are effective. The second thing is that if you have the current approved vaccines, you are not only protecting yourself, you are also helping to protect others who are around you. They could be family members, they could be other people you interact with, because your ability to spread the virus is much greatly reduced. So you're not going to be spreading the virus like someone who is not vaccinated. And so if you look at those benefits, the fact that the virus can prevent severe illness, the fact that it reduces the ability to, that you are not going to spread the virus as effectively as someone who has not been vaccinated, and also the fact that the viruses don't interfere with existing vaccines or medicines that are used to treat COVID-19, meaning that they do not greatly lower the effectiveness to the point that those medications or vaccines are useless. Those are all real benefits. And so overall, if you look at it, you don't lose anything by taking these vaccines. These vaccines are really safe. I know there are a few safety issues here and there that people point out, but I will give this example. A lot of women take the contraceptive pill on a daily basis. Those pills cause venous thrombosis, but people don't even give any thought to it. And do you know that the amount of thromboembolic events you can get from taking the contraceptive pills is far, 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 far more than any of these major side effects like blood clots that people are talking about with some of the vaccines. So, the reality is that it's unfortunate the vaccines have got some bad press because of a lot of misinformation that's out there. But I can tell you that these vaccines are highly effective, some of the most effective vaccines the world has ever seen. They are also very, very safe. I mean, if you have a situation in which 1 out of, say, 20 million people develop a particular event, of course, that one person that developed the event won't be a happy person. Chances are the person probably won't die. But if you look at the other extreme of not taking the vaccine and allowing the viruses to run rampant in the environment, several thousands, even into the hundreds of thousands, will die by comparison. So if you look at those two, it's not even a question, should I take the vaccine or not? It really should be a given. If people can go past the misinformation and the biases they have, then they should really be taking these vaccines. So I think at this point, all we can do is to continue to encourage people that taking the vaccine is beneficial for them and for their loved ones. But I don't know what more people can do other than, educating, encouraging, prodding, and letting them see the real statistics. Sometimes people resist something, but they don't even take the time to be objective and look at all the facts. It's okay for people to be skeptical about something. At the beginning of this pandemic, I could understand why so many people were skeptical. Well, the vaccine has been developed so quickly. Well, we don't know much about the technology that's used. Well, we don't know if it's going to cause me to develop 3 limbs instead of 2. Well, none of those things have happened. And millions of people have taken the vaccine. Enough data to help people see that, okay, there were these things I was worried about, but we're actually not seeing them, So I think we can just continue to educate and encourage, and that's all we can do at this point.
Thank you. Thank you.
Well,
Thank you very much, Dr. Jethro. So the people who have not been fully vaccinated, people who have not been vaccinated at all, are people of great concern. And it's important that we need to continue to encourage people. And that's also why we have this project, is to be able to improve vaccine uptake amongst our community. So we'll keep spreading that information and educating as many people as we can. So that brings me to a question. Somehow you may have answered it, but I think it's important to still reiterate these things, because we would also share this video and make it go wild. So we need more people to keep hearing about it. So Andre asked a question. He said, how do you view face masks in the prevention of the spread of the new variants?
Well, face mask is really the most basic thing that can help to arrest the spread of these viruses, right? Right from the very beginning. If everyone took wearing of face mask very seriously, we could have gotten the virus under control. But what happened was at the beginning, when when the viruses first came, many people didn't even believe it was real. Some people thought it was something manufactured by someone to, cause some problems. But then we eventually came to realize that it was real. These face masks have been shown to greatly reduce. I mean, what are you doing with a face mask? It acts as a physical barrier between the virus and your body. You can have 1 million of those viruses sticking to your skin. They won't get into your body. The only time they can get into your body is when there is an opening through which they can get in. And these viruses have affinity for our respiratory system. So obviously they go through the nose and the mouth. And these are the places we want to protect the most. If you can put a face mask, it physically minimizes the likelihood of the virus getting into your body. And when they give that recommendation of like 6 feet apart, if you are keeping such a distance, 6 feet apart, why 6 feet? Because if, for example, somebody coughs or sneezes, you have, droplets. If somebody sneezes or if you sneeze, sometimes you find little water particles that stick to your hand. Let's say you cover your mouth and you sneeze, you are going to find little water droplets. Those droplets can travel roughly, no more than 6 feet. So if you are close to someone that's coughing or sneezing, if you can maintain that distance of 6 feet, plus you wear a face mask, that is going to greatly reduce your likelihood of having the virus. Of course, a few may still find their way, but also know that it's a function of dose. And what I mean by dose is how much of that virus gets into your body at a point in time. You know that more than 80% of people that get exposed to the COVID virus don't come down with any disease, about 80%, right? Why? It's not because some of them didn't get exposed. Some might have gotten exposed, but the amount that got into their body was so small that their body was able to mount the appropriate immune response to deal with it. Because anything that's foreign that gets into our body is primed to deal with it. But in the case of COVID, because our bodies have never been exposed to this virus, it's new. So we didn't have any immunity to it. And for some people, they actually responded with an exaggerated immune response that actually ended up destroying them, because the body is trying everything it can to fight something that's new, to the point that it actually starts to harm its own self. And so what the vaccine does is that it gives a measured response and helps your body to be to recognize that particular virus, all those proteins I talked about, like the COVID-19 has spike protein. You see those spikes on the, if you ever saw the picture of COVID virus, you will see those spikes. They are a protein, a type of protein, spike protein. Those spikes are what allow them to stick to the cells so that they can then inject genetic material into the cell. Those spike proteins were the basis of the vaccinations. People looked at the gene sequence for those spike proteins and then used that to make vaccines, so that those vaccines now will recognize those spike proteins as foreign to the body, and then it allows your body to develop an immune response, so that any day you are exposed to a COVID virus, your body is already primed to know that this shouldn't be here. I have all my machineries in place. I'm ready to attack. And then your body can do it in a much safer way, in a much more measured way, that is not going to create more problem for you, but will actually help you to deal with the virus so that you don't come down with severe illness. And so mask, I mean, I can never overemphasize that. It is important. Even if you are vaccinated, it's still a good idea to wear the mask, because you don't want to, carry the virus, even if it doesn't cause you illness, and then transmit it to an innocent bystander. So, so if all of us can wear it, it's always going to be extremely helpful.
Thank you very much. I'm so glad that I asked that question. Mask is a popular thing, so we just think that, okay, so since it's a mask, there is enough information that we have about it. But I'm glad that I asked that question, because your answer actually enlightened us some more than just beyond the basic answer you could get, around putting on a face mask. Andrew has another important question, which I think would be very helpful. He said, how do you view booster shots? Do you think it is necessary if you have already been fully vaccinated?
Yeah, that's a good question. So, I mean, why do people even have to give booster shots? You have to know that, I mean, the reason, so for example, if you look at the flu virus, that every season, people have to go and get a different flu vaccine. Why? Because of those mutations I told you earlier. The virus changes very quickly, and the flu virus changes actually much more rapidly than very fortunate for us, the COVID virus is not mutating at a rapid pace. So while you can have the flu mutate like 4 times in a year, the COVID virus has only mutated a few times, in 1 year. And so that is something that is very useful. With a booster, so this is what happens when you first get a vaccine. As I said earlier, the vaccine helps your body to develop an immune response, which counters the virus. That immune response is by way of different things in your body, like antibodies. Antibodies are just a type of protein that go against the virus, the part of the virus that causes, that causes the virus to cause the problem it does. Is called an antigen. Is the part of the virus that triggers your body to mount an attack. So the antigen, so when your body has antibodies, it mounts an attack against the antigen, or the part of the virus that is subject to that immunogenic response. But the problem is that those antibodies and the other things that your body has primed, they can only last for X amount of time. Remember that for COVID-19, this is a new virus to the human population. So we do not know how long the antibodies and the other body's defense mechanisms that have been put into place, how long they will continue to last to protect us. So what happened was the people who went through clinical trial, the clinical trial that generated the data that allowed the vaccines to be approved, the companies continue to monitor them. You know, since the time that they were on the trial, they continue to monitor the amount of their immune response over time. So far, for some of these vaccines, it's been measured up to 8 months from the first time that they got the vaccine. And it's been shown that at the end of 8 months, most people will still maintain a very decent level of immunity. However, by that 8-month mark, they are now starting to see a gradual decline in the level of, which is not unusual. And so if you're having that decline, if you give an extra dose, it actually exponentially increase your level of immune response. This is what Johnson & Johnson has seen with their vaccine. They gave a single dose, and then, you know, like 6 months later, they gave a second dose. And that second dose is like 9-fold. It generates 9-fold of immune response, which is typically what happens with normal infection. Let's say you didn't get a vaccine at all. You were exposed to an infectious agent, triggers your body to mount an immune response. At first, it will be relatively mild immune response, just enough to take care of that virus, but those immune cells are ready for the next attack. The next time you get an attack of the same virus, your body will mount significant immune response. This is exactly the same thing happening with the vaccines. And so based on the data that is being generated right now, it's been recommended, I think for some of those vaccines, it's going to be like every 6 months, like or a booster in at least 6 months after the first one, like in the case of Johnson & Johnson. The others, Pfizer, BioNTech, and the Moderna, those have been recommended that, I think in the US, starting about September 20th, that if you were fully vaccinated, you should get a booster dose, because it will continue to maintain. Because see, you have to have a certain level of immune protection to not get sick from an infectious agent. So if, let's say you draw a line, and any level above that line will protect you, but any level below that line will no longer protect you effectively. This is what they are seeing among those patients, that some of that is starting to drop below that minimum threshold you need for protection. And as a result, by getting a booster, it greatly increases your immune response and allows you to be protected for even much longer. So it is highly recommended that when it comes time for us to get those boosters, we should take advantage of that and do it, because it can only serve us well. It's not going to harm us in any way. It's only going to allow us to continue to maintain our level of immune response and even much higher.
Thank you very much, Dr. Jethro. Juanita is, I think she's dropped a question. So Juanita, would you ask the question yourself?
So how would you talk to someone who is pretty much anti-vaccines? Like, how would you explain it to them in layman's terms?
That's a very good question, and a tall order, because the issues that are leading to vaccine, what you call vaccine hesitancy, they are fairly complex. It depends on, you know, what is causing someone to be hesitant, and without knowing exactly why, because I mean, the hesitancy is not the same for person A and person B. If you take person A, for example, say a Black person, maybe in their 70s, they were aware of some of the bad things done to Black people, you know, even by the government. When, you know, some people had syphilis, they were not told they had, you know, that they weren't receiving treatment. They thought they were getting treatment, they didn't. Up through the 70s, people that were adults through the 70s and are aware of that, maybe people that have made up their mind, I will never again trust the government. If you are dealing with a person like that, it's going to be extremely difficult to convince them other than to tell them that the world has really moved away from the practices of the 70s. Now there are things in place that allow greater transparency so that everybody can know and understand how these vaccines were tested. All the data around these vaccines are publicly available. Anybody can look at them and draw their own conclusions. And that, you know, where we are today is that all from the data we have, these vaccines show that they work. They show that they prevent people from getting severe COVID. They prevent death, they prevent hospitalization, and they are relatively safe. And as a result, you would encourage such a person to take that. You have other people whose problem is, right? There are people that it's more about all the misinformation that is out in the public domain. You have a number of Christians who believe that somehow this is a precursor to getting the number of the mark of the beast, 666, right? And that they don't want to be a part of it. They don't want to get that mark of the beast because they don't want to associate themselves with the beast. Now, for such people, this is a religious, a religiously driven vaccine hesitancy. So for such people, all that one can do is help them understand that there is nothing in the components of the vaccine that would suggest in any way that, you know, this vaccine is the mark of the beast. You can only try to encourage them and to have them take a look at the data themselves, or to challenge them to get somebody they trust and who knows how to interpret the data, to look up the data for them, you know, on their behalf, and to see that there's really nothing, there's no hidden agenda, there's nothing in those vaccines that is causing that. You have a whole lot of other people that are believing, I mean, you've seen some people hold up their cell phone over their shoulder and it's sticking, like there's a metal in the vaccine, that somebody who got the vaccine, you know, they take their cell phone and when they put it on their shoulder, it sticks, it doesn't drop, right? You have people like that. For such people, again, the reality is there are no metals in these vaccines, in the components that are magnetic in nature, that are going to cause a cell phone to stick. So there's a lot of misinformation, and how you can tell somebody who has vaccine hesitancy to change their mind is really a tall order, because people have made up their mind based on different reasons. And it's only when one understands the reason for their hesitancy, then you can try to meet them at the point of their resistance. But if you talk in general terms of, well, take the vaccine, it's, you know, helpful and stuff like that, if they've already made up their mind, it's very difficult. But we can't, that shouldn't discourage us from continuing to educate. We have to continue to encourage. We have to continue, which is why we are doing all that we are doing now. We have to continue talking to them. We have to continue reminding them that this vaccine, that this virus is still around with us, that the virus is still killing people. But we do know that people that have taken the vaccines, they are not dying compared to the people that have not taken the vaccine. Now, if death is not a strong enough of a deterrent to someone, honestly, I don't know what else could be. We know people are getting sick. There's no question about it. Just turn on your television screen, you will hear that the rates are rising in different states, just like it was at the beginning of the pandemic, and that people are getting hospitalized. You can see these people. You can see the doctors in the hospital that are telling us, look, more people are getting sick from this virus. And you can still see that people are dying. But if you look at the population that has received the vaccine, these are not the people that are dying. The people that are going to the hospital and that are dying are people who are not vaccinated. I mean, that's all we can tell people, and they have to come to their own judgment. But our responsibility is to continue to encourage them.
Amazing, awesome. James, are you there? You can go ahead with your question.
I think it was Joshua Fowler.
Yeah, there's a question from James and then also from Joshua. So anyone can jump in. Okay, let me just.
Yeah,
Go ahead and ask.
Yeah, if you can ask the question on,
Yeah,
ask the question on their behalf, and I will answer for everyone to hear.
All right. James is asking, he said, is it recommended for people who are vaccinated to get the booster and the flu shot this year?
Okay, so the COVID virus and the flu virus are very different viruses. So at this point, there is some anecdotal evidence that one vaccine could cross-protect the other virus. Protection means you are protected against virus A, and because you are protected against virus A, it can, to some extent, protect you against virus B. However, that is really not something that has been studied extensively to really draw the conclusion that that in fact is the case. And so if someone is concerned about getting the flu and also the COVID-19, it will be recommended to take both. But what you want to do is to make sure that there is a gap of at least 2 weeks in between those two vaccines. Don't take both of them on the same day, for example, or at the same time. You should take one and then wait at least 2 to 4 weeks before you take the second one. So you can have both. We do know, I mean, if you look at this year, for example, the number of cases of flu dropped dramatically, right? Because we had a lot of the COVID cases. But part of what caused that drop is also because many people were taking some of those preventive measures we talked about. People are washing their hands frequently. That's something we should continue to do. So the hygiene increased. People were maintaining social distancing to a large degree. Many people were sequestered in their homes. They couldn't go out as much. And then also many are now protected, at least half of the US population against the COVID-19, which may offer a little bit of cross protection to the flu. So all of these reasons together have allowed the rates of the flu to be dropped this year. But there is no reason whatsoever why somebody cannot get the vaccine for both illnesses, because they are very different. The viruses are different. The vaccines target those different viruses. And as you know, the flu virus also changes its form very frequently. Like I said earlier, about 4 times in a year, compared to, say 1 time for COVID-19 virus. So yes, the short answer is if you are concerned about both, get the vaccine for both, but just don't take them on the same day.
Thank you very much. Millie has a question. Millie, are you there? You can ask a question. Okay, let me ask. She said, I took the Moderna vaccine. Okay, great.
Yeah.
Go ahead, Millie.
I took the Moderna vaccine in March. And when are we supposed to do that? Probably in late November? I think they're saying 8 months.
Yeah, did you get both shots of the Moderna vaccine?
Yes, we had the first one in February, the second one in March.
Okay, yeah, which is 4 weeks later you get the second dose. So that means you are now fully vaccinated. Fully vaccinated means at least 2 weeks from the last dose. So because you are fully vaccinated, the plan now is, I think it's late this month or next month, they will start making available the booster doses. So I would say at the earliest opportunity that the booster vaccines, when they ahead and get your booster. Certainly people can get the booster, at any point in time beyond, say the 8 months, because 8 months is the time frame that Pfizer and Moderna have looked at so far. So we don't know what could happen, 10 months or 12 months, but what we don't want to do is to wait and let the level of immunity wane down before we get the booster. So if you get the booster as soon as you can, then you can rest assured that you continue to be fully protected. So I would say, maybe in October, try to get the booster. That will be very helpful.
Thank you, Doc. Mm-hmm.
Yeah.
All right, thank you very much. It looks like we've exhausted all of the questions that we have. Thank you, Dr. Jethro, for this wonderful session. It's been very helpful. Juanita said, thank you, Dr. Ekuta. This was helpful. I have run into a few of those folks as you described. I will take this information into consideration. Dante said, thank you so much for the presentation, Dr. Ekuta. Also, thank you so much, Ms. Helen, for allowing us to collaborate with such an amazing discussion. I hope everyone has a wonderful day. So there are quite a number of people who are saying thank you here. Let me scroll and see if I can get one more. Okay, yeah, so that's pretty much up somewhere, but everyone is saying thank you. We're saying thank you. I'm saying thank you too. And it's been a very informative session. And we are not done. Helen has, I'm just going to hand over the mic to Helen. But Dr. Jethro, don't leave yet because we have something
I'm not leaving.
to do.
Yeah, I'm still on.
Mississippi would need to say something as well.
Thank you.
So Helen, over to you.
Okay. So thank you, Dr. Ekuta. This was so helpful. And I know, like everyone else on this call, we all learned a great deal about the variants, but also got our questions asked because, excuse me, Garrett, James, and Dante Jiggets can't actually speak on behalf of Omega Psi Phi. I do have a comment from them that I did want to read out. So the Brothers of Psi New Chapter challenge all attendees to not just use the information themselves, but to become change agents and helping spread accurate and life-saving information related to COVID-19, its variant, and the vaccines. Together we can save our community. For more information on the activities of Psi New Chapter of the Omega Psi Phi Fraternity Incorporated, please visit psinuqs.com. That is psinuqus.com to connect with that organization. We look forward as an organization overall to continuing to collaborate with Omega Psi Phi as well as other institutions and organizations. And I'll hand it over to Ms. Iffy to conclude. And I do want to say one last time, thank you to everyone in the audience for coming. And thank you especially to Dr. Jethro Ekuta, not only for this presentation, but for being a constant advocate, stakeholder, and a presenter, and willingness to constantly contribute and show up when we ask him to. You are very, 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 very much appreciated. Thank you again. Ms. Effie? You're on mute, Ms. Effie.
Right. So I also want to thank you, Dr. Ekuta, for always being ready. Each time we call on you, you come in, you educate us, you empower us. And what I love the most about your presentation is that you really break it down. So everybody at any level, whether in the medical field or not, we all understand and follow you. So we thank you. On behalf of the board of directors, the staff, and all our volunteers, Ms. Helen, today we would like to present you with a plaque. Oh, I don't know if you can see it. Mr. Chris, there you go. So,
thank you.
With the plaque, we say thank you, Dr. Jethro Ekuta, for your leadership and willingness to educate our community on the effort of COVID-19. May God bless you. So thank you very, very much. We do appreciate you. And we really hope that, all our experts in the various fields would consider donating their time like you have, So we thank everybody who has been listening today. We are going to be having a series of webinars. So look out for the upcoming months, what is coming up. And we really hope you can join us. So once again, we thank you, Dr. Ekuta.
Well, thank you so much. I wasn't expecting this at all, and I'm truly very humbled by what you all have done. It's my honor and a privilege also to be able to share the little knowledge that I have about this virus and the vaccines, how they are developed. It's really an honor for me to share that with everyone else. And thank you for giving me the opportunity to do so. And I'm always available in whatever little ways that I can contribute. To me, I think life is very precious and every life is very important. So even if it is just one life that is saved from not dying because of misinformation, and each of us can contribute to that, I think that will really help. It's going to take all of us to do it collectively as a group. No one person is more knowledgeable than other people. It's just that we all are in different situations and settings, and we all get different pieces of information. But whatever information we have, however little, let's share that with others, because you never know which life you will be saving. So thank you again. I'm truly very humbled, and I really appreciate the gift. Thank you so much.
Thank you. And just one last announcement. So on behalf of AWCAA, we are putting together a training program. One is for credible ambassadors, local community ambassadors. So if you or someone in your community is actively serving your community across the DMV, specifically focused around COVID, please reach out to myself, Chris, Ms. Iffy, or anyone at AWCAA. In order to actually fill out the questionnaire, because we're looking to do a training for 40 ambassadors who will get CDC level training around COVID, as well as we're looking for additional partnering organizations. So feel free to reach out to us. I will leave my email. Chris will leave his email on here. You can all, and if you have any additional questions, you can always go to our email, info@awcaa.org. If you have any additional questions. Other than that, thank you everyone. We wish you all a safe, healthy, and blessed rest of your evening and coming weekends. This concludes this webinar. We look forward to the next one.
Thank you, Ms. Helen.
Thank you.
Thanks, everyone.